name's Kenzie. We're the student who's taking care of you today. I'm going to do a postpartum assessment on you. Can I just get your name and date of birth for me, please?
Logan Hedges, April 4th, 2003.
Okay, great. So I'm going to be doing some assessments, some vital signs. It might involve me touching you in some private areas. Is that all right with you?
Yeah, absolutely.
Okay. So first I'm going to take some vital signs. I would take your temperature. Sometimes with postpartum, it could cause infection. There's always that risk, so we just want to make sure you're not running a fever because that can be one sign of infection.
Right, absolutely.
Then we would get your pulse, take respirations at the same time, so that way they don't know that I'm taking the respirations, and then we would take blood pressure. If blood pressure can be too high, it can be a sign of preeclampsia, and if it's too low, that could mean that there may be some internal bleeding, or it could just mean that you're dehydrated, okay?
Mm-hmm.
So first I'm gonna go in, I'm gonna do a breast exam. Are you planning on breastfeeding at all?
I'm not sure which way I'm going to go yet.
Okay, so with breastfeeding, you just want to make sure that you have baby on each side 20 minutes for however long, every 2 hours usually. If you want to put some hot presses there, because sometimes with new mothers it can be crackling and just very uncomfortable. But I'm just going to feel around your breasts really quick. Okay, I'm just looking for any lumps or any tenderness. Are you feeling anything like that?
Nope.
Okay. If you were planning on just deciding on formula, wear a tight-fitting bra. I would look at your area, your nipples, but I won't touch them because touching them can be a form of stimulation and it could cause milk production to start. With a tight-fitting bra, you want to make sure when you're in the shower not to use hot water because that can also start the stimulation process. You want to maybe cover them, colder water, just depends. And then also you can also put some ice packs on there that would also kind of help with not stimulating any milk. Okay.
Right.
So next I'm going to go and I'm going to look at your uterus, okay? Like that. So at this point, I would be looking at your uterus. I would feel for where your uterus is located currently. At this point, it should maybe be one finger above or below your uterus, or above your umbilicus, sorry. But it could vary depending on. Are you feeling any pain? Okay. When was the last time that you went to the bathroom, like urinated?
It was probably today.
Today?
Mm-hmm.
And when was the last time you had a bowel movement?
That was a couple days ago.
A couple days ago? Okay. So when you give birth, sometimes, especially if you have a C-section, bowel sounds can be, or bowel can like stop moving a little bit. So it's important to make sure that they keep moving so you don't have any complications. I would recommend maybe a stool softener. If you don't want to go that route, maybe try some fiber and some water. But stool softeners are really the good way to go because we want your stool to be like chocolate pudding as a descriptor. But if you're not having any pain here, make sure that I know you said you went to the bathroom today, make sure when you do urinate, you urinate every hour, because if you forget to urinate, sometimes your uterus can shift. So we want to try to keep it midline. Sometimes it can shift over because that bladder is full. So just make sure that you urinate every hour. Okay, I'm going to now go down here. Are you feeling any pain or tenderness in your legs?
No.
Okay. And I don't see any swelling, so what can happen after giving birth if you're not walking around, because sometimes it can be uncomfortable, you can develop DVTs, which is deep vein thrombosis, which is basically blood clots in your legs. So if you see any unilateral swelling, just make sure you talk to a doctor about that, okay?
Yeah.
I'm gonna go look at your perineal area next, okay? So I'm going to open it up. I'm gonna look at your perineum, make sure it's not red, it doesn't have any edema, ecchymosis, any drainage, and make sure that everything looks good, okay? If you do notice, since you gave a vaginal birth, you might have some bloody on your pad. So depending on which stage, however long you gave birth, first it's going to start out with this red. If it gets to the point where it's more than the pad and it's overflowing within an hour, that's something that we need to talk about and we can talk to your doctor about, because that could be a sign of a red flag. But if it's less than like half the pad within an hour, that's probably where we want to stay. But your perineum looks good, your pad looks good. Might have to roll it to that side for me. I'm just checking back here, see if you had an epidural, and make sure that your spine, again, I would be looking for redness, edema, ecchymosis, discharge, all that around there. Sometimes you might notice an odor underneath because you did just give birth. Sometimes you might notice that odor, but if it becomes too much, then it's probably a sign that something else is going on. It also could be a sign of a UTI. So if you hold your bladder in too much, or if you're having painful urination, let us know, because that could also be a sign of a UTI. If you did have a C-section, we would have to look at your abdomen, making sure that your incision, if we had the incision out, looking at it, making sure that there's no redness, edema, all that, making sure it looks clean, making sure that the bandage looks good. Again, taking those stool softeners is very important. I would look at your IV site to make sure if you're getting any medications or fluids in. Again, redness, edema, all that stuff. And then again, if you were having a C-section, we would have you basically be numb from the abdomen down or breast down. So you need to have a Foley in place. So I would look at that also to make sure that there is no infection or a UTI happening. Okay?
Yeah.
Do you have any questions for me?
I don't think so.
Okay.